That was a very beautiful song, and I love it. Yeah, so today is a health day, and we're going to talk about our health. So we are all here today because we are healthy. None of us would be here if we were on admission in the hospital or we were in a sick bed at home. So health always is a very important thing, and as children of God, He's given us a lot of principles in the Bible and through a lot of writings about how to keep ourselves healthy, so we can actually do the work of the Lord. We can visit our friends and then do all the other things that Christians have to do. We can only do them when we are healthy. So today we have the opportunity to talk about our health, and then today is going for the men. So we're going to talk more in the direction of the men. But then our women here, we control most of the things that we do at home, especially the married men. So it's good that you are here, so you can actually listen as well, and also put some of these things that we learn here into our diet, so that you can actually have a healthy life as a family. So I know next time we have a day for women as well to talk about something that is more specific to women as well. So today is more in the direction of the men today, and we are going to talk about more of prostate, basically. So prostate cancer and the prostate enlargement. I will lean more towards enlargement because it tends to be more of the majority of the cases that most men get prostate enlargement as they grow. So we'll be talking about that today. So I hope we learn more of that and then put it into practice and then know more about ourselves. Do you have a comment or you go from there? Yeah, so as they introduced me earlier, my name is Alfred. I'm a nurse, basically. So we learn more about men's health today, and we are talking about prostate enlargement and the prostate cancer. Yeah, so by the end of the lesson, we know more about ourselves today. So let's talk about. I'll be trying to be very fast because we don't have a lot of time today, and we'll be wrapping up with one of the elders coming to wrap the whole Sabbath off. So I have to run very fast. So let's pay attention so we can have a lot to do. So what is prostate hyperplasia, or and why does it happen? So this is an organ found only in males. So women don't have this organ. It's called a prostate, and we learn about why is there and then why does it get enlarged when we grow. So this organ normally when we are younger, there's no problem with that. But as we age past our 50s into our 60s, most men find trouble with this organ because it starts to grow bigger than what is normally supposed to be the normal size. And because of the development in the size, it tends to affect how we are able to pass urine as normal people. And this tends to be a problem for so many people. So when we say prostate hyperplasia, as the name implies, it's a non-cancerous. Normally, so with the enlargement, it's not cancer. It's not cancer. So when you go to hospital or any of your family has prostate enlargement, it's not a cancer issue. It's just an unknown reason why it goes from its usual size to a more bigger size. So commonly found seen in men over the age of 50 because of what aging and hormonal changes. Cases are now being reported in men in their 40s as well. So some time ago, it was seen only in men who are 50, 60, and then going forward into their 70s and 80s and very much into old age. But these days, we see cases in about 40 years as well. So things are beginning to change very, very fast. And one of the reasons they think is because of the male hormones. So males have a lot of androgen. The reason why we are males is because of what our hormones, testosterone is there in our body, and then these all hormones as we age start to have effect on us, and then it causes some of these organs to change how they were normally created to be, and it starts to affect our overall general health. So this is how the prostate looks like. So every our urinary system, whether we are males or females, we all have the same way of producing urine as it comes out. But the way it comes out is different in males and in females. So this is how it looks like. We have the bigger one at the top, which is the red one, is the bladder. So we have a big bladder where, as we produce urine, it is stored in there, and then as the volume increases, we have the edge to go and what? Wee. And below the bladder line, this organ, that's the little the pinkish organ down there. The left, the one on my right, left is the normal one, and the one on my right is the abnormal one, where the size begins to what increase. So you can see that in the first one on my left, the is patent, the way through is the urethra. So it's more patent, but in the one on my right, the is now becoming obstructed by the enlargement of the organ. So this is what it looks like normally when you have the normal one and when you have the abnormal one. So what is prostate and what is the function? So why is it there? So this is a small peanut-sized organ. It's like a one, and some people describe it that way. And then it's only found in males, like I said earlier on. It is normally a small, firm, and partly muscular gland that helps us with the male reproductive system. So this organ produces part of our semen that help with reproduction. Normally, that's the function. It produces fluid that helps with semen and surrounded part of the urethra. So it's like a highway with the buildings on the east side, and then now so just like in our highways or our streets, the street is there and comes building on both sides of the street. That's how it normally looks like. And then as we the size increases, and then it can go to the size of a lemon. So it's like a walnut at normal stages. But when things begin to change and start to grow, it can grow to the size of a lemon in extreme cases. So just imagine how much difference it grows. It can be very big sometimes. Yeah. So this is the anatomy of the urinary system. This is how everybody's urinary system is, whether you are male or female. So we all have these systems going to our kidneys, and our kidneys produce urine. It gets into our urethras, and then it comes all the way to our bladder to wait for the volume to increase. And once it hits a certain volume, the nerve endings in your body send signals to your brain that you need to go for a wee, and now you go. So this is how it looks like with everybody. But the way it comes out between female and male is where the difference lies. Yeah, we've seen this already. So this is the normal prostate, and this is the enlarged prostate, and then how it affects the urethra where the urine comes out. So this is the difference. Yeah. Okay, so let's look at the difference. So normally we hear people having prostate cancer and prostate enlargement. These are two different cases, but we normally confuse the two sometimes because of maybe knowledge gap or the fact that they all relate to the prostate. So like I said earlier, when you talk about prostate enlargement, just the enlargement, but in the case of cancer, it's different because in that case, the prostate takes different forms. The cells begin to multiply at abnormal rates and start affecting our general body. In the state of the prostate enlargement, it's just located in the prostate and no further to any other organ. But in the case of prostate cancer, the cells begin to multiply rapidly, and then it affects other organs around the urinary system and even into our bones sometimes when it begins to, when we say metastasis, travel from where they originally are into any other areas adjacent or into our blood sometimes. So I said earlier on, in BPH, they're just enlargement, no other complications. But in the case of cancer, it becomes more cell division and then getting enlarged because of the cell and the cancer that we have in the body. So one thing we should know that it's important to know that BPH does not develop into cancer. When you have the prostate enlargement, it doesn't develop into cancer. It just remains BPH. But the two can live together. You can have enlargement and also have cancer all within the prostate at the same time, sometimes, which it can happen. But they are two different conditions, diseases that all happen to men. But as to then living together, it can happen, but they can't develop from enlargement into a cancer. So what the difference continues. So both conditions causes urinary issues. So when you have prostate cancer, you have urinary issues. When you have prostate enlargement, too, you have urinary issues. Uh, so BPH is progressive. The enlargement is progressive as you age. So when maybe you are in your 50s, you start seeing symptoms of this condition, and as you go into your 60s, the symptoms become much more severe, and it's progressive condition. It tends to grow as your age also goes up. So when you have the condition in your 50s, you still start seeing symptoms of urinary problems. You go into your 60s, it becomes much more severe. It is more severe. Yeah, so in both conditions, we have something we call PSA. That is, when you go to hospital and they want you present your problem to your GP about your difficulty passing urine, going to urinate much more frequent than usual, or feeling that you're not able to empty your bladder completely, or dribbling. Sometimes you feel like you pass urine, but as you walk along, you see that you start dribbling into your pants. These are the problems you present to your GP. They will begin to look into the reason why these things are happening. And one of the reasons, they will do something we call PSA as a blood test to look at whether your antigen levels are going up. So in both conditions, these levels are actually high, but in the case of cancer, it's extremely high as compared to just enlargement. So this is one of the difference as well. So let's look at the statistics as to how much people are suffering from this condition, and then as men, how we can look at ourselves and then protect ourselves from this condition as much as we can. You cannot actually rule out. So far as you are a man, you are predisposed already. But as to how much we can do ourselves to reduce the chances, we can do something about it. So according to the WHO, BPH is highly prevalent condition among aging men, with global cases increasing by 112% from 1990 to 2001. So this is some of the statistics. So that means the number of cases are actually increasing very rapidly over the years. And I think there's new statistics, but this is what I found now. We have an increase of 112% within a space of I don't know, maybe 20 years. That's a very high increase. So it's always on the rise. Most of the cases exist in older men between the ages of 60 and 69. These are the bracket of people who have most of the conditions. So when you are about 60, 69, 70, then you should actually be able to keep an eye on your how much urine you are passing, and if your routine of passing urine has actually changed over the years. So age prevalence, around 40% of men over 60 years are having lower urinary tract symptoms. So 40% of all men are having this problem. That's a very huge number. So imagine we have 10 people, of them are suffering from a condition. That means the number is very high in the population. So men over 60 years are having this problem quite much frequent. The numbers of the cases are increasing rapidly due to aging population. So now people are living much more longer as compared to previous because of increase in health access, increase in medication, increase in overall awareness of our bodies and then everything. So now people are living much more longer. And we said this condition happened in older men. So the more people live longer, that means the more people are going to have problems with their prostate and then urinary symptoms as they age. So we should keep an eye on that. As we age, we should just keep an eye on how much urine we are passing and if there's pain or any problem with their urine output. So coming back together, so you talk about enlargement already. Let's look at the cancer as well. So cancer is the fourth most diagnosed cancer around the world. So putting all the cancers in the world on the table, prostate cancer is the fourth most diagnosed. I think it was after breast cancer in females and also colon cancer as well. And then I think this becomes the fourth largest number of cancers we have among the population, the whole world. So that means it's very much common as well. So the disease is heterogeneous. That means there's a lot of reasons, a lot of factors that come into play to diagnose this condition. The disease with incidence rate that is very significant across the world is 6.3 to 83.4 per 100,000 people. So if you take any 100,000 people, you get about 6.3 to 4.8, 83.4 people having it in 10,000 people. That is for the prostate cancer. 1 in 8 men are diagnosed with this cancer in their lifetime. So that is a quite high number to have 1 in 8 men having prostate cancer in their lifetime. And this is not all people. It depends on where you are located in the world. So we think that men with African origin are much more susceptible to having prostate cancer as compared to other ethnicities. So most of my brothers here are having African descent. So we are high risk as well. So let's keep an eye on our everyday life and how to protect ourselves if we can. So we have modifiable factors, things we can do something about, and those you cannot do anything about. So let's look at the modifiable factors and see if we can do something to help ourselves. So what are the risk factors? What are the things that predisposes us to having, especially with the prostate enlargement that we call the BPH, benign prostate hyperplasia? What are the things that put us at risk of getting it? So we are looking at the first one. There are no specific causes. You should know that there's no like kind of infection that you say, okay, this is caused by malaria or this is caused by this. We don't know what causes it, but we know some things that actually predisposes us to having it. So the first one is aging. Aging is no modifiable factor. You can't do anything about aging. Once you are born, you grow and you become an old person. So we can't do anything about aging, but it's the main reason why we have it, because you don't have people in their 20s having this condition, they haven't heard of anything like that, or in their 50s having this condition. So the number one predisposing factor is that you age, and once you are aging, you are at risk. Once you are a man, you have a prostate and you are aging, you have a risk of having prostate enlargement. So that's the number one factor. And we go to number two. Number two become lifestyle. So this is the modifiable factors. Those who can actually do something about it. So our lifestyle, what do we do as people? That's put us at risk. So high dietary inflammation index. So we have some foods that actually increase our inflammatory index. And this, because it's an enlargement, inflammation plays a very critical role in how this thing works. So including processed meats, refined sugars, trans fats, and are all linked to high risk. Obesity or lack of exercise also a very high risk. So when I was in nursing school, one thing I learned is that with every condition that you have, obesity is always a risk factor. So we should do something about how much we keep our weight in check so that we don't predispose ourselves to some of these conditions. And also there's the family history. So there's some families that this condition runs through, and once you have your grandfather having it, your father had it, there's a high chance of you having it as well. So if you know that in your family, people have been having problems with their prostate over the years, you should keep your body in check. Anytime there's any deviation, you can start looking at answers before you get into trouble. So there's always a family line as to how these things travel. And once it runs through families, there's a high chance of you having it when you belong to that family as well. And we look at medical conditions. When you are having some medical conditions already in your body, like you have diabetes, you have high blood pressure, or you have heart disease, your chances of having this condition also increases as well. It's not the cause, but it's one of the predisposing factors to this condition. And we have ethnicity. So we know that the prevalence varies across ethnic groups, but then there's a high chance among Western countries. So we saw that in the case of cancer, it's more prevalent in African descent, but in the case of prostate enlargement, it's more to the Western countries. Our friends who are from Western world, you are having a high chance of having prostate enlargement as compared to your African brothers. Yeah, so that's one of the things. How do you know that you have this condition? So how do you know that you are kind of having problem with your prostate? Yeah, so you have three levels of so the first one is obstruction. So obstructive symptoms where you have like there's something obstructing your urine flow. That's one cardinal sign of telling you that you have problem with your prostate. So the first one is this results in urinary hesitancy. So you feel like if I don't go now, I'm going to pee myself right now. So when you are about 40, getting to your 50s, and you start having symptoms of I need to go now or I pee myself, then you should be worried. There's a weak urine stream. So you know our urine stream, how it works. With men, when we are kids, they are able to wee all the way, like you see what kids do. They wee all the way like that, and they're happy. As men, the boys will do that. The girls don't do that, but the boys, when we're in primary school, most of them do it travel very, very far, and then they wee all like that. But when you are at this age and you start having these problems, your urine stream becomes much more weaker. It's almost getting onto your shoes already, and you should be, start getting worried about whether there's a problem with your prostate or not. Then we go to something like straining or prolonged voiding. I think urination is more like one of the easiest, easy to do. Just go there and then repeat. But when you start having obstruction, there's something stopping your urine from coming out smoothly like it's supposed to be. Then you have to kind of strain, almost like you're going for it. Yeah, you have to strain before the urine actually comes out because you now want to pass an obstruction which is stopping the urine from what coming out easily. So then you become to worry that why am I having to strain before I pee? Yeah, so that is the obstructive symptoms. Then we go to the irritative symptoms. This results increase in frequency. So now you go more than necessary. At night you go to bed and then you're not able to sleep because you have to wake up every half an hour to go for a wee, which is not very normal. So that is the frequency as to how much you pee, especially at night. And then we go to the nocturia, like I said earlier, I want to read too much at night, and now begin to affect your quality of life and the quality of your sleep. So that is when there's a problem. And then urge incontinence, I said that earlier. If you don't go, then you pee yourself, then you become urge incontinence, and then reduce voiding volume. How much you weigh is now reduced. You feel like you want to wee, but then you go and then there's a tiny bit comes out. You see this more in the hospital. People come to hospital and then they want to be like, I want to wee. You want to help them, you give them a bottle, and they pee like that, 10 mils. And the next half an hour they ask again, I want to pee, and they pee tiny bit. Something like you didn't say. So that's when there's a problem with somebody's prostate already. Yeah. So and another you will have like dribbling after urination and feeling of incomplete emptying of the bladder after urination. So that's I said earlier on, you pee and then you go you walk around and feel like there's still dribbling coming down your pants or you're getting wet with time. Then there's a problem. Or also you feel like you've peed already, but you feel like there's still much more urine settled in your bladder. I think the feeling of incomplete emptying of your bladder after urination. So that's where you feel like no, something's very wrong with my prostate already. All these symptoms develop gradually with age. So most of them who develop EPA do not require treatment unless symptoms become more troublesome. So as you age, these things come in. It's not more of a problem. People don't be able to be, you not receive treatment. But when it becomes a trouble and affect your everyday quality of life, then you should be looking at answers and then finding treatment for that. Yeah, so that is some of the symptoms we got having enlarged prostate. And then how do we diagnose it? So you go and present your symptoms to a GP, and now you have to look at answers as to how to help you. How will they be very sure that it's one of these conditions that you are having? So normally they will do rectal examination where they will invite you for examination and then palpate your prostate to see how big it is, and then they're able to confirm whether it's still a walnut or it's now a lemon or whatever sign it is. Then they can be able to see for sure that you have this condition. And they will put for residual urine. I said earlier on that when you urine and you still feel like your bladder is full, it's a symptom. So they will normally let you go for a wee, and after the wee, they will do bladder scan there to see how much urine you are still having after you've gone for the wee. If it is a certain amount, which is not normal, even though you go for a wee and you come back and have 300 ml of urine in your bladder, it's not normal. Then we can actually base on this to say that you're having a problem, it needs to be solved. Also, they do PSA, which I said earlier on. So all these, our bodies produce certain types of proteins in our body when they are having trouble. So when you go to hospital with a heart problem, they will do troponin test to see if your heart is struggling. If you go to hospital with a liver problem, they will do the liver function test. They will do kidney function test for your kidney, and they will do thyroid function test. So all these organs in our bodies have some certain amount of protein that they produce, and it shows on the lab test to show that when you're having a problem. So in the case of the prostate, you have the PSA, which is elevated when you have prostate enlargement or prostate cancer. So they do this test to confirm the levels, and then if it's high, then they will start treating you. And they can do ultrasound as well, and also sometimes they do cystoscopy to have a visual look at your bladder and your urethra and see how they are actually doing. So these are the type of diagnostic tests that they will do in hospital to confirm that you are having problem with your prostate or any of the uterine system in the male that you are having. Yeah, so these are some of the tests. So now let's go to the treatment. So now you have the condition as a man. Don't be bothered too much. It can affect your quality of life, but there's a plan in place to help you to kind of live a normal life, even when you're having some of these troubles. So there are systems in place and treatment plans available for men to live quality of life, even when they are getting into their 50s, 60s, 80s, and they're having problems with their prostate. So we have pharmacological treatment where we give you medication or we do a surgery to make sure that we reduce the size of the prostate or help you live a normal quality of life. So with the surgical treatment, there's an golden treatment model that we've been in place. It's kind of the golden treatment, that is the TURP, transurethral resection of the prostate. So what happens in this case is that they will pass instruments to your urethra, going into your prostate, and then do resection, kind of reduce the size. That is the golden treatment, and then it's been in place for a very long time. And until recently, that new research and the new treatment models are coming in. It used to be the number one standard that people do. So most times people will still go under this treatment to make sure that you reduce the size of their prostate so that they can have a normal life again. So that you have normal urine flow, and then all these symptoms of waking up at night and having dribbles will just go down as much as possible so you can have everyday normal life. Or you go to the new, which is very, very new. I think in our trust here as Basingstoke Trust, we've done the first one and then it's been successful just I think a month ago. So it's now being under research and people are now looking into this one. We call it aquablation. So aquablation is just it's a robotic surgery. It's kind of very robotic where they use water to wash out some of the prostate areas to make sure that there's a patency in there. So this new surgical technique that involves robot-assisted water jets that can precisely target upgrade prostate tissues. So it's very new. More research is being done into it, but then now it started being used in more hospitals now. It's working, but we don't know the long term as to how fast the cells become obstructed again. But for now, it's working. So if you have any issues, they can suggest one of these procedures to you to help you. The second one is actually working perfectly because it has no effect on the reproductive organs and everything. So you can maintain your reproductive system and then also have a decent life, which doesn't include obstruction of bleeding. So this is the new one that is coming up now. And we have pharmacological. So this is where we give you medications, which helps you to have a normal life again. So we have a lot of medications, but the popular one is tamsulosin and then finasteride. It's been in the system for a very long time, and it's been used for a lot of males. So you see, you go to the world, you see men in their 60s, 10 of them, at least you find 2 of them who are some of these medications, either tamsulosin or finasteride, because it's a very common medication. The first one, finasteride, just help the muscles to relax. So if you have a large prostate obstructing your urine, they give this medication so that the cells become very relaxed, so they don't obstruct it too much. So we have that is tamsulosin, very common medication, and we have finasteride, which is the 5-alpha reductase inhibitor. So what this medication does is that it just reduces how much your hormones act on yourself. So they reduce how much so we know that these conditions are caused because we have male hormones. So the fact that you are male is the reason why you have this condition. So we produce testosterone, and then that's in the raw form of the hormone. For it to become very potent, it needs to be acted on by this 5-alpha lactase hormone. So what this medication does is that it stops that, it breaks that gap. So you go to the market to go and buy food items. It's not food yet until you put it on fire. So the fire becomes that 5-alpha reductase. So what this medication does is that it just stops the fire from working so that it doesn't develop into food. So you don't develop the testosterone into the very potent form, which is the reason why we have this enlargement issue as males. So it reduces how much money you have. This basically just stop your hormones from working normally. So when they don't work too much, you don't get your prostate very enlarged and very obstructed to affect your quality of life and having urine every day and also struggling to pass urine. So these are some of the medications that you normally have in hospital when you have some of these problems as a man. And we continue with the management. So we talk about catheter. So most of us have heard about catheterization before. So we have this is the canal going out, and something is stopping it halfway. So we use a stick to kind of push the thing away. That's how catheter works. So we put a tube and then bypass the obstruction so that urine will go straight from your bladder through the tube outside without having to. So there's obstruction. How do we bypass the obstruction? Let's put artificial tubing through your uterus from outside, connect it to a bag so that your urine will come straight from your bladder and come through the tube into the outside without having to strain or all those complications that comes with it. So we have 2 types. If the obstruction is not too much, we just push it through your uterus into your bladder. When the obstruction is too much and there's a problem that we cannot pass through the enlarged prostate into your bladder, we can actually do an incision in your abdomen and in your pubic area and put the tube there into your bladder. So we call it that one suprapubic catheter. So we have 2 types: urethral catheter and then suprapubic catheter, based on how much problem you have and how you want to help with the situation. It's not only men that have catheter; women also have it as well, based on certain conditions that they also what happen. So it's not just a male procedure, but it's for everyone based on your medical condition that you have to help with the situation. So if you see a catheter, don't be worried. People wear it long term. Some people also wear it short term. So you see people around, they have leg bags that they attach to their legs. So you see them in buses, they walk normal life, but you still have these candidates with them everywhere that they go, and they bring it out when the bag is full. It's not anything too much. So let's address ourselves some of these things so you don't be shocked when you see them in the on our family members or anybody who has it, because it's becoming much more normal now to have a quality of life without having something stopping you from doing what you're supposed to do. So we have candidates which has been helping for so long and still continue to play a vital role in the overall general care. So you go to hospitals and they are hanging on the bedside with you in it. They just normal. Some of them are short term, they come off after whatever reason why you put there is resolved, or you wear it long term when you're not able to get a hand on the problem. So we can keep it very long time. Some of them so you die. Yeah. So this catheter, some of us have seen it before, some of us have been seen it before. So this is how it appears. It's a rubber tubing. Some of them are latex, some of them are very silicone. So you to the bladder, and then you connect it to a bag, and then it drains out into the bag, and the bag is empty anytime that it is full. So this is how a catheter normally looks like. Or you go the suprapelvic way where you make an incision into your abdomen, just above your suprapelvic bone, and then into your bladder, and connect the bag to it, and it works also. If the problem is that you cannot pass through your ureters into your bladder, this is the second most common option that we normally use for draining our urine. And okay. So all that aside, we need to have kind of find a way to protect ourselves if able. If it's a modifiable factor, like something we can do something about our diet, our lifestyle, exercise, nutrition, everything, then we need to learn something about how diet plays a role in as males to protect us from having this condition. So in the first one, there's a good amount of evidence for lifestyle and dietary modification that can reduce our risk of having problem with our prostate as men. So there's a lot of research to tell us that some of these things are very possible, and a proper lifestyle, eat well, exercise, drink more water and everything, there's a chance that even if you have the chance of getting it, it can be reduced very significantly. We are what you eat, basically, that's a very popular quotation. So whatever you eat is what makes you. So you should eat properly so you can have a healthy life. So let's look at some key nutrients that help with prostate health. So zinc. Zinc is a very essential element in male health. So if you have a lot of zinc in your body, if you eat a lot of zinc, you are very in a good shape to reduce your chance of having this condition. Vitamin D, it also plays a role in regulating cell growth and differentiation. So in the case of cancer in prostate, it's just because our cells are dividing too fast and they're not following the regulation that God put in place for them to follow. Now the cells are now going, they are growing stubborn and they are doing what they want to do. But if you eat a lot of vitamin D, it plays a role in how the cells grow and how they differentiate into the good ones and the one that is supposed to die and come out. So then we have antioxidants. We've always been mentioning antioxidant because oxidation is the one that causes problem in our body. So if you do a lot of food that do have antioxidant factors, it kills the free radicals and our body are able to stay in the good shape. And we have omega-3 fatty acids. So these are very important fatty acids that helps with reducing inflammation in our body. So we're going to look at where these food sources are and how we can eat them properly. Yeah, so there's a recent research in 2024 from Sarika Keller. Research suggests that diet based on fruit and vegetables, legumes, whole grains, nuts, and healthy fats promote healthy prostate and slow its growth. So I said as you grow, your prostate also grows. So once you eat healthy, there are some foods that slow how much growth this prostate can have. And some of the food sources are here. So let's look at the antioxidants first. Which foods contain antioxidants? Which food sources contain antioxidants? As examples, fruits, vegetables. So especially with the berries, we have strawberries and blueberries. It helps regulate free radicals in our body. So we can increase our intake of strawberries and blueberries as men if we want to keep an eye on our prostate health. Yeah. Also, we have for the inflammation, the prostatitis, which foods are having anti-inflammatory properties. So we have, like I said, fatty fish, omega-3 rich foods. So with the fatty fish, we have just a couple of them. Salmon is a very good source of fatty acids. And then macro, but we don't eat macro as advantage, so we can keep the salmon. Yes. And there's sardines as well. Sardines are also very good source of fatty, healthy fat. Also, anti-inflammatory properties in these fishes help us to keep healthy most of our days on earth. And we can look at the prostate cancer. Antioxidants also help very much, and then the very one which is very popular is tomatoes. So with men, our intake of tomatoes is very, very important. That's if you look at a lot of researches, they will mention tomatoes. So our ladies, if you're cooking our food for us, we need to eat more tomatoes. So let's keep an eye on our intake of tomato because it contains something we call lycopene, and lycopene is as compared. So on the research I read, they said that the cooked ones actually have a lot of this lycopene as compared to uncooked ones. Even though uncooked tomatoes are very good, we should eat a lot of cooked tomatoes. Either we grill it or we whatever we do, tomato juice and all those things are important for us. Because there's a study done in Brazil in 2023 which showed that men who ate a lot of cooked tomatoes reduce their chance of having prostate cancer by 35%, between 10 to 35%. So we should increase our intake of tomatoes in every form that we can, so that we can keep an eye on our prostate health as men. And these are some food we can also add to our diet that can also help with the prostate health. Example, green tea, because of its antioxidant properties. So green tea contains a lot of antioxidant properties, so we should increase our intake of that. And mushroom as well. Pomegranate, I don't think that, but those who fancy a lot of tropical food, you can try eating a lot of pomegranate because it helps very much. And we have something called pumpkin seeds. So those who love to eat a lot of seeds, you can add pumpkin seeds to your intake of that, so it can help with your prostate health. And the all popular turmeric is very important as well because of its anti-inflammatory properties. It has anti-cancer properties based on the recent study that has been happening around the world. You know that turmeric is very important in our everyday diet. It also helps in the fight against cancer in men. And the food we have to avoid, yeah, as much as possible, we need to either cut down on how much you eat or stop eating it if it's possible with red meat because of its research has shown that it increases the chance of having cancer generally, not just prostate cancer, but general cancer in our body. So over consumption of beef, lamb, pork can increase the risk of prostate enlargement and cancer, especially when they are grilled, barbecued, or smoked. So as much as possible, we can reduce how much of this food we eat. Even if we can stop eating it, we can cut down on how much of it we eat every day. Yeah, and it can have a very healthy prostate as we grow older. And then milk products, so too much milk products also have a risk of eating and increasing our prostate, prostate gland, yes. And then consumption of too much sodium as well. We know that when you consume sodium, you produce so much urine. So producing too much urine put pressure also on the prostate as well. Because we know that wherever sodium goes, water follows. So you eat so much sodium, you produce so much urine, and then you put pressure on your prostate gland as well. So in as much as possible, we should reduce our intake of processed food, like soya beans, sausages, and all those things. Even though we eat them, we should cut down on how much we eat them, and as much as possible, do a lot of natural food like fruit, vegetables, and then tubers. These are food that are able to help us with our general health and also protect our prostate as well. So these are some of the things that we need to do. So what we learn about our prostate today, as God has given us a chance to learn about our health so that as Christians we can live healthy life, so we can go about our daily life and then support the ministry of the Lord Jesus Christ. So this is what we learn today. I'll give time for some questions and contributions if we have enough time. Thank you.
What do we say to the Lord?
Amen.
You know, everything we can do, we don't take the credit to ourselves, we take it to God. And so when we say a big amen to God, we say, God bless our brother. Can we say a big amen to the Lord? And can we all say, God bless you? God bless you. It's such an in-depth education and a learning curve for every one of us. And we've really learned a lot. But as customs, we would love to also open the scripture a bit more.